This is organ bath, and this organ bath is used for isolated tissue preparation. Whenever you do any type of the bioassay, you need this organ bath and this rotating drum. It is called as the Sherrington rotating drum. So we will just discuss what are the different parts of this organ bath and what is their importance. First, it consists of outer bath, and this bath is composed of perspex glass material. This water bath is filled with the water which maintain the temperature. Another part attached to this is the inner bath. It is consist of the glass, and as it is consist of the glass, we can see the muscle or tissue from outside. So it is called as the organ tube, where we can mount the organ. This organ tube is connected with this coil, and from this we can insert the physiological salt solution into this organ tube. Now there is one outlet for removing of this PSS from organ tube. Apart from this, it also containing this coil. This coil is required for the heating coil, and it will maintain the temperature of this outer environment. This is a thermostat which also maintain the required amount of the temperature as per the tissue. Here there is a on-off switch is given. Accordingly, you can start the thermostat as well as the coil. Then we have this one assessment. This is called as the tissue mounting needle. So here we can hold the tissue at the tissue holder. We can put a tissue here and then attach. So it containing a small you can see here the small hole, and this hole is required for making the air bubble outside. So from here we can put the aerator, and this aerator will provide the air, that is the carbogen oxygen, to the tissue. This is attached here after attaching the tissue. Now then next is this part. It is called as the fulcrum. It is easily movable. So this fulcrum is used for attachment of the lever. This is the frontal lever. You can observe it is a tip, right? It is also called as the writing tip. So this lever is attached here into the fulcrum, and it is attached horizontally, and it will move easily like this. So whenever tissue get contract, it will shows the responses. So this is another part. Apart from this, there will be a stirrer which maintaining the temperature of the bath. Now the aeration is provided by means of this aerator, and this aerator is many a time you have observed in aquarium. So you can put this aerator to the plug, and this portion of the aerator is attached to this part. Then it will give the air to the tissue. Now the another important portion of this organ bath is this rotating drum. It is also called as the Sherrington rotating drum or kymograph. Over this drum we can put a white paper, and whatever the responses is there with the tissue contraction or relaxation, that can be recorded over this drum. So So today we are going to see how the setup is done to get a proper responses by using isolated tissue preparation. So here you have observed that in first you have to take the muscle, and if you observe here, the muscle is tied to the muscle holder, as the muscle holder is given here, and it is attached to the aerator. If you observe, the slowly one by one the bubble are going on in upward direction, so that will provide the oxygen to the tissue. So by this way, one end of the muscle is attached to the muscle holder and another end is attached to the liver. So this is what the muscle holder, and to this is the aerator which is attached here, and this will provide the aeration. Now the important thing in this experiment is that this is the fulcrum, and here we have to attach the lever. Now the lever is balanced using the wax, so that the lever should be horizontal. Now this distance is taken based on the magnification value. Now here you have to observe that the thread is attached to the lever, and this thread should not be stick to this connector or this organ tube. Very important thing is that when you fill the PSS into organ tube, you have to mark here, and every time you have to fill the PSS up to this point, otherwise there is a change in the dilution and you will not get a proper response. Then for balancing purpose you have to use the wax, and the amount of wax which has to be applied is depending on the type of the tissue, whether it is the smooth muscle or skeletal muscle. Then you have to, after this, you have to put the ink here. This is a writing tip. Here you have to put the ink. Now before going with the experiment, you have to relax the tissue, and the relaxation is approximately for 20 minutes. So once you have tied the tissue to this lever, you have to put a small weight here attached, and you can just left the weight in this way. So here you can observe there is a stretching developed in the tissue, and this stretching will produces the relaxation of the tissue. So after 20 minutes you have to again pull this, and you have to observe that the lever is in horizontal way. Then you have to attach this chymogram to the lever. Now start the Sherrington recording drum. Now here we will get the baseline for 30 seconds. After 30 second baseline, without interfering with the Sherrington recording drum, add the drug. While adding the drug, care should be taken that the needle should be enter into the PSS, and slowly you can release the drug. And the response is taken for 45 seconds. After 45 seconds, you stop the Sherrington recording drum and just put this load down so that you will get such a line. Now for 15 seconds you can carry out the washing of the tissue. Minimum 2 to 3 washing should be given, and then for second response again you have to put this load above and observe that this writing tip is there at this baseline area. Now you can take the another baseline and increase the dose and take the response. This is all about the experiment.